Hello everyone, welcome to our Windstroke webinar brought to you by LAMP AccuWellness Foundation Inc. as part of its continuing LAMP lecture series. Today we will talk about scalp acupuncture on the motor area. Three basic features of scalp acupuncture that differentiate it from body acupuncture. The treatment zones mapped onto scalp associated with body functions and broad body regions. The needles inserted within the thin layer of loose tissue beneath the scalp surface at 15 to 30 degrees, insertion distance of about 1 cun. Needles are subjected to rapid stimulation, pulling or thrusting, twirling, electrostimulation. Treatment principle for point selection. The forward part of the zone, which is nearer the face, is used to treat the upper body. The rear part of the zone, the lower body, and the functional zones, sensory, motor, and memory, the back and sides of the scalp. Needling depth. The standard acupuncture of scalp points would involve subcutaneous insertion up to a depth 1/2 cun or less, 0.3 to 0.5 inch, at a high angle of 60 to 90 degrees. In scalp acupuncture, needles are inserted at low angle of 15 to 30 degrees, insertion distance of 1 cun. Standard acupuncture applied to scalp points would involve less rapid stimulation or moxibustion as main stimulation technique. In scalp acupuncture, we stimulate the needles for 2 to 3 minutes at a time with a rest period of 5 to 10 minutes between stimulations. The technique is small needle therapy in which shoe points in the scalp are treated. Shoe points are stream points where the chi of internal organs is infused. In body acupuncture, there are 5 shoe points on each of the 12 meridians, below the elbow or below the knee, plus back shoe points, each located in the vicinity of internal organ. Shoe points in the head can be used to treat diseases of the whole body. The 3 major contributors to the development of this system are Jiao Shunfa, Feng Yinpeng, Tang Songyan. Each proposed different diagrams and groupings of scalp acupuncture points. Jiao divided scalp points into motor and sensory areas. Feng, writing or speech and reading or memory centers. And Tang, upper, middle, lower burner areas. Jiao advocated the use of rapid twirling with penetrating and transverse needling. Feng, slight twirling method and oblique needling. And Tang proposed the use of long-duration needle retention with superficial stimulation of needles using lifting and thrusting method. Scalp acupuncture is effective in treating disorders of the central nervous system and acute and chronic pain syndromes, like neurasthenia, anxiety neurosis, periarthritis of the shoulders, ischialgia, pain in the back and loin, painful heels, hemiplegia, aphasia, senile dementia. Bai Wei, or GV20, is the basis for scalp points. It stabilizes ascending yang, clears senses, calms the spirit. The governing vessel enters the brain at GV16. The governing vessel external pathway is used to divide left and right sides of the scalp. Left side governs the chi, right side governs the blood. Needling of the left side has greater impact on disorders of the left side of the head and neck, but of the right side of the body below the neck, and conversely. Several different systems are used, like Jiao, Ju, Yamamoto. Jiao system is the most common. There are 5 layers to the scalp: the skin, connective tissue layer, galea aponeurotica, loose areolar connective tissue, and the pericranium. The needles should be inserted at a depth of 10 millimeters, lying between the aponeurosis layer and the loose areolar connective tissue. Needles resting too deep or too shallow at the scalp structure will cause pain and diminished effect. After the insertion, mild stimulation to the needles is recommended. The brain can be divided into three basic units: the forebrain, the midbrain, and the hindbrain. The hindbrain includes the upper part of the spinal cord, the brainstem, and a wrinkled ball of tissue called the cerebellum. The hindbrain controls the body's vital functions, such as respiration and heart rate. The brain is divided into main functional sections called lobes. These sections, or brain lobes, are called the frontal lobe, temporal lobe, parietal lobe, occipital lobe, the cerebellum, and the brainstem. The cerebral cortex contains three types of functional areas: motor areas, sensory areas, and association areas. Motor areas control motor activities, while sensory areas receive sensory information through afferent fibers via thalamic nuclei. Scalp acupuncture is a relatively modern acupuncture method. One of the Chinese styles was attributed by Dr. Zhao Shunfa, a physician in northern China, and it has been used in China since 1971. The principle of scalp acupuncture is very straightforward: to stimulate the diseased area of the brain in order to facilitate a return of function in that area. All scalp points are representations of the underlying functional areas of the brain. Thus, the most common use of scalp acupuncture will be in diseases in which there is brain damage, such as CVAs or severe head injuries. The anterior-posterior midline is the midline of the head, connecting the glabellum with the lower border of external occipital protuberance. The eyebrow occipital line, a line from the midpoint of the upper border of the eyebrow diagonally to the tip of the external occipital protuberance. The external occipital protuberance is a normal anatomical structure located on the posterior surface of the occipital bone at the level of the superior nuchal line. It is the insertion site of the nuchal ligament. The external occipital protuberance may show hyperostosis and may get prominent and causing pain. An examination reveals presence of tender bony swelling. However, such occurrence is extremely uncommon. The lump you feel at the base of the skull in the back is normal. It is a bony part of the skull that sticks out and feels hard. If you feel carefully, you will find one on yourself or other children. Near the middle of the squamous part of occipital bone is the external occipital protuberance, the highest point of which is referred to as the inion. The motor area is located over the anterior central convolution of the cerebral cortex, being aligned starting from a point 0.5 centimeter posterior to the midpoint of the anterior posterior midline of the head and stretching diagonally to the juncture between the eyebrow occipital line and the anterior border of the corner of temporal hairline is indistinct. Draw a vertical line upward from the middle point of the zygomatic arch to the eyebrow occipital line. The intersection of the two lines is the projection of the motor area. Locate the upper point 0.5 centimeter posterior to the midpoint of the anterior posterior midline. Then, locate the lower point at the intersection of the eyebrow occipital line with the anterior temporal hairline. The line connecting the upper and lower points is the motor area. This line is divided into 5 equal portions. The motor area is located on the projective area of the scalp, corresponding to the precentral gyrus of the frontal lobe. The line of motor area determines the angle and location of sensory area and chorea and tremor area. The motor area of the cerebral cortex controls and adjusts intersectional body movements. One side of the cerebral cortex controls contralateral muscles of the body in the level below the neck. Exception: most head and face muscles are bilateral. The size of motor gyrus of the cerebral cortex is associated with complexity and accuracy of body movement. A larger representative area equates to greater complexity and accuracy. The upper part of the gyrus controls the lower limbs. The middle part of the gyrus controls the upper limbs. The lower parts control the head and face movement. The motor area has three regions. The upper 1/5 treats contralateral movement dysfunction of the lower extremity, trunk, spinal cord, and neck. Middle 2/5 contralateral movement dysfunction of the upper extremity. The lower 2/5 bilateral movement dysfunction of the face and head. These areas are used to affect contralateral side. The direction of needling is from upper part of the area downward, penetrating to the entire area. The indications for the motor area include paralysis or weakness in the face, trunk, or limbs caused by a stroke, and also multiple sclerosis and traumatic paraplegia. When treating thrombotic and embolic stroke, scalp acupuncture treatment should begin as soon as possible. When treating hemorrhagic stroke, scalp acupuncture treatment should not be performed until patient's condition is stable, at least 1 month after the stroke. Greatest response to treatment will be for strokes occurring less than a year prior to scalp acupuncture. The longer the duration of the impairment, the more gradual the improvement will be. With long-term impairment, expectations need to be realistic, although some patients will occasionally surprise practitioners. Improvement is rare for patients with a long history of paralysis that has led to muscular atrophy, rigid joints, and inflexibility. When treating chronic progressive diseases like multiple sclerosis and Parkinson's, results from treatment are sometimes temporary. Results may last for hours, days, weeks, or months, but ongoing follow-up treatments will be necessary. When treating paralysis from either stroke or trauma, improvements of movement are often permanent. Paralyzed extremities are targeted by treating the opposite side of motor area in the scalp. If the patient has paralysis of right leg and foot, needles inserted into the patient's left side of the scalp motor area. For patients undergoing brain surgery or with an injury where part of the brain was removed, needling should be on the same side of the scalp as the side of paralyzed limb. When one area is impaired, the impaired area can recover to a limited extent. By employing proper stimulation, other areas can compensate for the impaired area. This explains mechanism of scalp acupuncture in treating cerebral cortex impairment. Treating motor dysfunction. Place needles and rotate them at 200 times per minute for 2 to 3 minutes every 10 minutes for a total of 30 to 60 minutes. More difficult cases require longer treatment times. For best results, patients should feel something in the reference area: tingling, movement, twitching, heat, and cold. After stimulating the needles, begin passive and active movement of the affected limbs. Have the patient walk with or without assistance as indicated between stimulations. Initially, treatment should be twice a week until major improvements are achieved, then once weekly, then every 2 weeks, then spaced out as indicated by the patient's condition. The needle size often mentioned in Chinese texts for scalp acupuncture is 26, 28, or 30 gauges, which is suitable for rapid twirling techniques. Needle stimulation technique, the thrust and pulse method, a somewhat finer needle gauge of 32 or 34 is suitable for most cases, and the insertion length is approximately 1 tsum. A 30 mm needle with a wound head is thought to be the best. The needle must be long enough so that it is not inserted up to the handle. but short enough that there will not be any bending during insertion and manipulation. The angle of insertion is typically 15 to 25 degrees. The patient should not feel pain, though there are some rarely used scalp points along the sides of the head mentioned above that typically produce pain. The subaponeurotic space is a loose layer of connective tissue that is ideal for penetration during scalp needling. The needle slides in smoothly and does not cause pain, yet the desired needling sensation is strong. If the angle of needling is too shallow, the needle will penetrate the skin and muscle layers, and it will be difficult to get a smooth insertion. Upon inserting the needle, stimulation is applied for 1 to 2 minutes. The needles are manipulated again after intervals of 10 to 15 minutes for 1 to 2 minutes each time throughout the duration of the patient visit, which may be as long as 2 to 3 hours. Sometimes the interval between needle stimulation sessions is longer due to insufficient staff time when there are numerous patients, but usually within 30 minutes. The needle should remain in the scalp for a minimum of 4 hours, except for treatment of acute symptoms, in which case 0.5 to 1 hour is sufficient, and up to a maximum of 2 days. However, for children and weak adults, the time of retention should be shorter. The needle is inserted along the practitioner's nail, pressing the skin. Press beside the treatment zones with the nail of the thumb and first finger of the left hand. Hold the needle with the right hand and keep the needle tip closely against the nail. By avoiding the hair follicle, one can minimize pain during insertion. The direction of needling is usually based on the mapping of the body within the zone being treated. The needle is aimed along the line of the zone toward that portion of the zone most closely corresponding to the area of the body that is affected by the injury or disease. There are 2 basic needling methods for manipulating the qi, but we shall only discuss Jing Qi. Both involve rapid, short-distance movements. Jing Qi, Jin means move forward, is a tonifying thrusting method. Thrust the needle quickly with violent force, but the body of the needle doesn't move, or no more than 0.1 tsun in. Following the thrust, the needle is allowed to settle back to its original position. In most cases, treatment is given every day, at least 5 days per week, for 1 to 2 weeks, then every other day for another 1 to 2 weeks, followed by twice per week treatment for as long as necessary. The frequency of treatment may be adjusted according to the severity of the condition and rate of improvement. For best results in treating hemiplegia due to stroke, scalp acupuncture should initially be performed twice per day. For other chronic conditions, daily treatment or every other day treatment is recommended for the initial therapeutic plan, to be followed up by less frequent treatments once progress has been made. The course of treatment typically involves 10 to 12 consecutive sessions, followed by the break of 2 to 4 days, sometimes 5 to 7 days. The frequently mentioned method of rapid needle twirling may be replaced in some cases by other methods, including electrical stimulation, because of the potential for causing pain for the patient and fatigue and irritation for the acupuncturist. At least one study compared the efficacy of twirling, manual and machine-aided, and electrical stimulation, and the conclusion was that both were useful. During stimulation in all cases, it is always important to achieve needling sensation, known as qi arrival, which is experienced by patients. It is also often described as aching or soreness, numbness or tingling, fullness, distension or pressure, and heaviness. And this is felt by the acupuncturists, the needle grasping as tense, tight, and also there could be pressure, electrical impulse, not pain. Another important feature is that it often spreads or radiates from the point of origin, which is called extended sensation throughout the meridians or channels, and many textbooks identify this as the flow of qi. And they also manifest as skin redness or localized red or white lines along the meridians of the body surface And this may be due in part to the rising popularity of new acupuncture modalities, such as electroacupuncture, which in most cases help to accomplish stimulations instead of twirling in the range of 150 to 300 needle rotations per minute. Needle manipulation, which is at least 2 to 3 times in the course of a single session for 2 to 3 minutes each time. The manipulation is usually rapid with frequency of twirling in the range of 150 to 300 per minute, which with the electrical stimulation, it was reported in the range of 150 to 700 per minute. Total duration of needle retention varies between 30 to 45 minutes. Indications for scalp acupuncture include virtually all the usual indications for body acupuncture, but the main applications are stroke, paralysis, pain, and emergency situations. Contraindications for scalp acupuncture includes very high blood pressure, 220/120, heart disease, infection, post-operative scars in the acupuncture zone, some cases of pregnancy, mainly habitual miscarriage, persons who are extremely nervous, and infants whose fontanelles have not closed. It is also contraindicated to use electroacupuncture in those patients with implanted pacemakers and/or defibrillator. Thank you very much for your attention.